All right, welcome back to ABA exam review and the continuation of our RBT practice exam series where we're going through another set of questions together and breaking them down. If you're new to the channel, welcome. If you're returning, welcome back. Please like and subscribe. Check out btexamreview.com for all of our study materials, including our combo pack. When you pass your exam, let us know so we can include you in the Sunday shout-out. Work hard, study hard. Let's get going. Jamal independently uses the restroom at a therapy clinic but has frequent accidents at home and school. His parents and teachers report he never asked to use the bathroom in those locations. During your next supervision meeting with your supervising analyst, what would you recommend as the most likely explanation and solution? Now, as the RBT, you are often with the client more than your supervisor is, and information might be shared with you about certain skills or programs or behaviors. In this case, the question wants to know, what would you recommend as the RBT next time you're meeting with your analyst? Let's assume the analyst asked you what you would do. We know Jamal is independently using the restroom at the clinic, but he's having accidents at home and school. So Jamal is able to independently use the restroom. He's just not doing it everywhere. Parents and teachers say he doesn't ask to use the bathroom in those locations. What would you do in this situation based on this information? A, Jamal is being defiant in other settings and needs a behavior intervention plan. We don't know anything about Jamal being defiant or not. We just know that they are reporting he doesn't ask to use the bathroom. He might not be engaging in behaviors that might be considered defiant or not compliant. Maybe he just isn't asking or doesn't know, right? He's never been taught or there's no training going on in these other locations. B, Jamal hasn't truly mastered toileting and needs to restart training from the beginning. Well, he's able to do it in the clinic, so starting over from the beginning doesn't make a whole lot of sense. C, the skill hasn't generalized to other environments. Implement training in home and school settings. Yeah, that's the simplest explanation. The skill has failed to generalize to these other environments. What we need to do now is go into the other environments and do some of the same training we did with the clinic. We don't just hope generalization happens, we actually plan for generalization and teach generalization. D, the parents and teachers need better training on how to prompt Jamal. We're unsure, right? D's a possibility, okay? But that doesn't really explain why he's not asking or what you might recommend. That's just trying to correct the parent and teacher behavior rather than focusing on what Jamal needs. And so in that case, we could, through the training in home and school settings, achieve D while taking it even further and trying to get to generalization in these other settings. So what would we recommend? The skill hasn't generalized to other environments. Implement training in home and school settings. You're implementing a token economy where a client earns tokens for completing tasks and can exchange 5 tokens for 10 minutes of video game time. The client earns their 5th token, but when they try to exchange the tokens, you realize you forgot to charge the tablet and it's not available. What should you do? So immediately you've already made a mistake as the RBT. One of the task list agendas is to be prepared for session, and not having reinforcement ready is not being prepared. What's happening here is the client is engaging with the token system appropriately. They're going to get their 5 tokens and then they can exchange it. What you've done since you failed to prepare for session is you've removed a possible backup reinforcer or a reinforcer we can exchange tokens for, and now we've got to figure something else out. So in this case, if you were in the situation, we know the client has earned their tokens, they've earned their break, what can you do? A, provide an alternative backup reinforcer of similar value and report the situation to your supervisor. It's probably the best bet here, right? Hopefully there's another reinforcement available because they did earn their 5th token and they can exchange it for something. And you need to tell your analyst what occurred in case there is behavior that goes along with it. B, give the client the tokens back and tell them to try again later. The client earned their tokens. If they want to exchange it, we need to be ready to exchange it. We have to follow the plan. C, provide extra tokens as an apology for the mistake. Well, that's not part of the plan, and we shouldn't just give tokens that were not earned necessarily, right? So even though you may have messed up by not charging the iPad, we can't just give them extra tokens for your mistake. That's not following the economy. D, have the client continue to work without exchanging tokens until the tablet is charged. The client wants to exchange tokens. They've done their work. They've hit the requirement. We can't just make them continue to work. Again, you're not sticking to the economy, and the economies should be very controlled and systematic. So the best way here is to try to get the exchange to happen with an alternative backup, and then report the situation to your supervisor. While reviewing graphs from the past month, you notice your client's target behavior shows a clear upward trend during morning sessions, but a flat or decreasing trend during afternoon sessions. The treatment protocol and your implementation have remained consistent. What will be the most appropriate action? Now, what do we know about trends, right? Trends are the direction our data paths are moving. Upward implies something is increasing, downward and decreasing, and it can be flat. In this case, we know that the client's target behavior is moving in an upward trend during morning, but flat or decreasing during afternoon. So time of day, there seems to be a distinct difference in trends, but the treatment protocol and implementation have remained consistent. What's the appropriate action and what might be the reason? A, share this observation with your BCBA as time of day may be affecting the intervention's effectiveness. Is it true that time of day can affect behavior? Of course. How you act in the morning may be different than how you act in the afternoon versus the night, and it's no different than the clients we work with. And so if you notice a trend like this, it's very important you let your BCBA know or your supervisor know. It could provide valuable insight into the behavior as a whole. B, assume you're implementing the program incorrectly in the afternoon and make adjustments. What says your implementation and treatment have remained consistent? It doesn't seem to be any indication that you're doing anything wrong. So I don't think you would jump to the conclusion that you're doing something incorrectly. C, recommend discontinuing afternoon sessions since they're not producing results. Well, this is a good opportunity to figure out what's going on in the afternoon. This is valuable information. D, continue as planned without mentioning it since some variability is expected. Now, this is absolutely something that you want to mention. This is important information. There's a clear distinction in time of day, and we want to figure out why as behavior analysts. So going ahead and letting your supervisor know is a very appropriate action. So what should you do? Share your observation with your BCBA as time of day may be affecting the intervention's effectiveness. A family you work with mentions their teenager has been diagnosed with depression and started medication last week. They ask whether you've noticed any behavior changes and if you think the medication is helping. How should you respond? Now, what are we qualified to speak about as RBTEs and analysts? Well, we can talk about behavior, right? What we can't talk about is medication, unless you're somehow a doctor, right? And also a BCBA, and you are certified and competent in medication. You shouldn't give advice on medication. So if you have a family who says a teenager has been diagnosed with depression and started medication, they then ask you about behavior in the medication. If it's helping, what can you speak on? How can you respond? A, share your observations about behavior changes, but avoid commenting on medication effectiveness as outside your scope. Sure, you can absolutely say, and hopefully you have data as well, showing behavior has changed, behavior has not changed. Typically, when a big change occurs in someone's life, like medication, we'll make a note, we'll put a condition change line or something indicating this is where medication was added. That way we have a good idea of what behavior is doing, let's say the next few weeks or so. B, tell them you cannot discuss medical or mental health topics at all. Well, it's not that you can't discuss them, right? And as the RBT, you do want to be careful about what you're discussing, but you just definitely cannot give recommendations about medication. You're not trained in that area. C, provide your opinion about the medication since you work closely with their child. Even though you work closely with them, you're not in a place to give medical recommendations. D, recommend they discontinue the medication if you noticed any negative changes. If you do notice negative changes, of course, let them know, but you're not one to say whether or not that medication should continue or not. So give your opinion on the behavior. Has behavior changed? Is it different? And then leave it at that. So share observations about behavior changes, but avoid commenting on medication effectiveness as that's outside your scope. During a play session, a client reaches for a toy airplane on a high shelf but cannot reach it. You wait and position yourself near the toy. The client looks at you and reaches toward the plane. You say plane please, and wait. The client attempts to say pain, and you immediately provide the airplane with enthusiasm. What naturalistic teaching procedure are you implementing? All right, we have a naturalistic teaching question, and it specifies naturalistic teaching, and it wants to know which one you're implementing. Well, during play, the client reaches for a toy airplane but can't reach it. So you use this opportunity to what? Get them to communicate their needs. Client looks at you, reaches toward the plane, you say plane please. They say plane, and you provide the airplane. You're teaching them to functionally communicate and ask for what they want. So how will we describe this procedure? A, discrete trial training. Well, discrete trial training is the opposite of naturalistic teaching. Discrete trial training is systematic and contrived. B, manned training using naturalistic opportunities. What is a manned? A manned is a request. Here you're teaching the client to request what they need using naturalistic opportunities. C, tact training with errorless learning. What is tact? A tact is a label, but you're not using errorless learning. They have a chance to make a mistake. D, echoic training in the natural environment. What's an echoic? When they copy you exactly. You're not teaching them to copy what you say. You're teaching them to demand or request for what they need. So, what procedure are you implementing? Manned training using naturalistic opportunities. Thanks for watching. Be sure to check out ABA Exam Review and btexamreview.com. Subscribe for all of our updates. Our 3rd edition task list study guide is now out on YouTube. Be sure to find that. As always, work hard, study hard, and we'll see you soon.